Hello, everyone. I want to thank SAGES for this opportunity to present our work. I'm going to be presenting our paper entitled Marijuana Use Does Not Affect Weight Loss or Complication Rate After Bariatric Surgery. So we as the authors have no disclosures except for we come from a state where marijuana is legal. So marijuana legalization is becoming more and more common throughout the United States. 18 states have now fully legalized marijuana for recreational use, including Nevada, with decriminalization laws present in 13 states. Cannabis has been legal in Oregon, our home state, since 2015. So delta-9 tetrahydrocannabinol, or THC as you probably know it, is the best known active compound within marijuana. It has those known effects on the central nervous system, leading to the well-known high that comes with a marijuana use. Cannabidiol, or CBD, is commonly used for inflammation or pain relief. So as marijuana use has become more common, it's inevitably shown up in our bariatric surgery population. Patients with obesity have a higher prevalence of substance use disorders, and it's been well established that patients who are post-bariatric surgery have an increased risk for developing substance use disorders after surgery. There is some concern that THC-stimulated appetite may undermine weight loss after metabolic surgery. And there's also some concern that there might be an increased cardiovascular risk with a long-term marijuana use. So, show of hands, who in here would consider marijuana usage a contraindication to surgery in your patient population? A couple people, all right. So, our current studies on marijuana use in bariatric surgery have not really shown an effect on complications or weight loss outcomes. So our purpose of our study was to examine the effects of our self-reported marijuana use on weight loss outcomes and complication rates on bariatric surgery patients in a state where we've had legalized recreational marijuana use for 5 years. So we undertook a retrospective review of all our patients who underwent bariatric surgery at our institution after the legalization of marijuana in the state of Oregon in 2015. We included all our patients undergoing Roux-en-Y or sleeve gastrectomy who were over the age of 18, and we excluded any revisional or conversion type surgeries. Patients are asked on their initial intake questionnaire if they are currently or have previously used marijuana products. We then classified our patients as active users, previous users, or never users. We got our demographics and weights and comorbidities from our charts, and complications were then defined by the MBSA QIP definitions. So we ended up with over 1,000 patients included in the study, with about 22% of them having a Roux-en-Y gastric bypass, 78% having a sleeve gastrectomy. Of these patients, the majority of them reported no marijuana use, but 225 reported previous use, and 84 were actively using marijuana when they were in our bariatric program. Interestingly, the patients who are reporting active marijuana use had the highest recorded weight within 1 year of surgery, and that was statistically significant. BMI was also higher, but that didn't quite reach statistical significance. There was no other factors that differed between our patients. So in our multivariate regression model looking at weight loss, we did find weight loss was higher in Roux-en-Y gastric bypass compared to sleeve, as we might expect. It was higher in younger patients versus our older patients, and patients who had higher weight when they came into the program lost more weight. Importantly, prior or current marijuana use did not really affect weight loss in our cohort. So here we graphed it out. This shows percent weight loss over time after surgery. Weight loss levels out at about 1 year to 2 years. For both groups. Marijuana users may have a little bit more weight loss than non-users, but this wasn't statistically significant. So now let's look at the complications. I think this is the thing that a lot of people are really worried about with our marijuana use. Complication rate, as with we've talked about many times in SAGES so far, is really low for bariatric surgery. So overall, we have very few complications in general. There was no difference in overall complications among the different groups of marijuana users. If we look specifically at Roux-en-Y gastric bypass, no differences. But we did find that for sleeve gastrectomy patients, there was a slightly higher utilization of outpatient IV therapy needs within 30 days. There was also a slightly higher number of reoperations for users compared to non-users. I do want to caution interpreting these results. There were such a low number of complications. I think we're going to need a larger number of patients to really get a good really get a good idea of this. What I thought was interesting is when we looked at the marijuana numbers over time, it's pretty apparent that more patients are reporting using marijuana than in the first year of the study. This may be more due to more accurate reporting by our patients. It may be due to increased acceptance of marijuana use after the legalization, or it may reflect higher usage patterns among patients with the legalization of the drug. Either way, more and more patients are reporting using marijuana than ever before. And we're in Vegas, so I'm going to take the bet that every single one of you bariatric surgery surgeons out there are going to take care of a patient that uses marijuana. So overall, this is the largest study to date on marijuana usage in bariatric surgery patients. We found that marijuana users had a higher weight prior than non-users, but there's no difference in weight loss outcomes. Overall, complications are low, but there may be more IV infusions in marijuana users. But most importantly, marijuana use is increasing. You will have patients that use marijuana and also use bariatric surgery. All right, thank you so much, and I want to open myself up for questions.